thank you all, thank you Tom, and thank you the steering committee for having me speak today. My experience with IONS has always been inviting and warm and such a wonderful community. It was here in Richmond and kind of within that time during my residency that I was introduced to Tom, and then obviously met them in the same night. Oh, closer? Okay. And I've learned so much during that time within residency, but also within this group about healing and spirituality and what it means to really be human. So I kind of take all those experiences now into my practice, and I kind of developed this talk to share a little bit about the history of naturopathic medicine, because it is not by any means new in this country or new in the world even, and kind of where we are now in the United States within the current conventional medical system, and that we share roots and that we share history, and that there, throughout history there has always been this drive and interest in understanding the body and how to heal, and so I want to just share those pieces and kind of how I got into this, and then where my fiance and I are taking our practice in our community, and why it resonates with us so much. So without further ado, I would really like to hear from you all in the audience, if you would want to share what words or what comes to mind when you think of medicine or when you think of conventional medicine.
I was in a class taught by a psychic, and he said, well, he had worked for the American government, and he said, do you guys know how the U.S. healthcare system was created? He said, back in the last century, the U.S. government wanted to know whether there was any value in holistic medicine, so they hired one drug company to do a study. He said, what do you think the results were?
Right. Yeah, thank you.
You're welcome.
Yes.
Okay. I don't know if you know this or not. It's fascinating. It was back, I don't remember the exact year. It was either 1908 or 1910 when science and Western medicine declared that the only things in this world that are real are the things you can see and the things you can touch.
Mm-hmm.
That causes their model to be very, very limited. There is a whole ton about living things. It's way more than what you can see and touch.
Yeah.
And then they present themselves as if they know everything.
Mm-hmm.
There are incredible things that they do. Antibiotics, vaccines, finding DNA, incredible stuff they do. But their model is very, very limited.
Yeah, that's perfect.
What you can see and what you can touch.
Yes, 1910, we will talk about that.
It was 1910?
Yes.
Okay, thank you.
Yeah, anyone else? Okay, awesome. Yeah, so I think when I think of conventional medicine in this country, now knowing so many different holistic therapies and practitioners and Reiki, and now we have this whole melting pot of healing practices, I think of conventional medicine in this country as a monolith. It is so, the way that mainstream medicine is, it's like you're almost funneled into making certain decisions. It can be a lot of pressure on the patient. So actually, when I was graduating from my engineering program, I graduated with an engineering science degree and a concentration in biomedicine. So the exact opposite of what I'm doing now. And my career options were research and development, going to a conventional medical school, or going into a consulting, working with a pharmaceutical company. And I was in the line at AstraZeneca at a career fair, and looking around at all of the PhDs, masters, graduates, people that had decades more experience than me. We were all in the same line. And I was thinking to myself, it's so interesting that we're all trying to work for a company that, kind of in general, when we think about the pharmaceutical industry, a business model that's based on a product that it doesn't ensure that you don't continue to need the product. And that to me was kind of the light bulb that was like, I think I need to do something different. And that's when I kind of got into more nutrition and yoga and exercise and other things. So I would love to I love the information you both shared, because we will touch on that. And we're going even further back into the origins of medicine in general, Western medicine in general, to look at, where did that divergence occur, and to really speak to, even though, naturopathic medicine is not as widely known in America now, why is that? And that the threads are actually much older than we really think they are. So, so naturopathic medicine is a system that emphasizes prevention, treatment, optimal health using therapeutic modalities that encourage the individual's inherent systems of healing. In other words, the body has an inherent ability to heal itself, and naturopathic medicine covers any therapy that will support that inherent force to heal itself so that the person can achieve that state of health. This was specifically referring to in that time period, and we'll talk about the origins, but around the 1800s, they were specifically referring to earth, water, air, light therapy, so elemental therapy. So this bears some similar resemblance to systems like Ayurvedic medicine and Chinese five-element theory. As it started with that elemental therapies, like what they had available to them, with that definition, it's since been broadened to include things like homeopathy and herbalism, dietetics, bodywork, breathwork. But in terms of the actual origins, and I want to just caveat with this narrative kind of lacks the acknowledgement of more traditional systems of medicine that have been practiced for thousands of years prior to Hippocrates, which did also provide influence into the development of Western medicine. But what I'm sharing today is just pertinent parts of that story that speak to the origins and development of our current medical system, and perhaps reasons for the relative marginalization of holistic and natural therapies within that system. So Western medicine, as we know it in the modern sense, in this country, around 300 BC, begins with Hippocrates' teachings on the four humors. So he is often credited with being the father of Western medicine, but it was actually understood 200 years prior to that, that the balance of the body was solely affected by the balance of these four fluids in the body, known as humors: blood, yellow bile, black bile, and phlegm. And each of these fluids had a connection to one of the natural elements. So this is where it's kind of crossing over with that elemental theory in more Eastern medicine. So black bile represented earth, cold and dry properties. Yellow bile represented fire, warm and dry properties. Blood was air, moist and warm, and then phlegm was water, moist and cold. So I had a little bit of training in Ayurvedic medicine. This is very similar to Tridosha theory, where phlegm and maybe phlegm and black bile are very similar to kapha, which is earth and water, etc. So there's a little bit of that crossover. This is also similar to Western herbalism, which looks at thermals and energetics of herbs, flowers, bark, buds, and leaves and fruit to understand the medicinal properties and use, and then how to use that with the body's energetics and thermals as well. Hippocrates noted the importance of cold water therapy and infamously stated, "Let food be thy medicine." This is the true root of Western medicine, and we've just, we've departed somewhat from that. Hippocrates also believed in the connection between the mind and body, and his student, Claudius Galen, elaborated on these theories and noted changes in mental and emotional well-being based on the balance of those fluids or humors as well. And these were the origins of the field of psychology. However, at the time, it was argued that these theories were not based in science, and it wasn't until further study in anatomy and then later physiology, like Deborah was stating about that if we can't see it or measure it or understand it in that sense, if we can't view it in a laboratory and understand it that way, then it's not considered science-based, which is kind of a myopic way of looking at things, which is funny to me because there was already such a rich and vast knowledge available. But this is when Western medicine took more of that systematic and then scientific approach to the practice of medicine. Much of what they learned about the inner workings of the human body was from cadaver dissections and clinical experience. And as blood chemistry specifically and imaging technologies improved, we were able to understand a vast amount about human anatomy and physiology, which led to discoveries such as red blood cells and bacteria, germ theory, and then early forms of vaccination. And it was the first time that a biomarker or a pathogen could be identified, studied, and measured. And this was the beginning of that path of evolution in medicine. Western medicine shifted dramatically over the next 2 millennia and traded its holistic roots for the more mechanistic and allopathic approach. But not everybody agreed with that direction at this time. And when in naturopathic medical colleges, we talk about the history of medicine because we want to understand where that divergence occurred and understand, what they were observing at that period of time, and does it hold true today? That is also a form of scientific evidence-based medicine. In Ayurveda as well, direct observation is a form of evidence and scientifically based too. So we don't necessarily throw the baby out with the bathwater. We listen to our elders and our history and understand, does it resonate? Does it still hold true? So Paracelsus, around 1500 AD, not necessarily a student of Hippocrates, but was a Swiss physician and metallurgy enthusiast, so the beginnings of alchemy and things like that. He sought many experienced teachers at different universities, and his infamy was in his criticism of the current direction of medicine. He questioned the new medical teachings and believed that experience was the most important form of knowledge. He famously denounced teachings of Galen and then Avicenna or Ibn Sina in Egypt, who is again credited with being one of the first conventional medical physicians of that time. So that's famously, and there is a book and then a movie called The Physician, also quite good. But he basically said that these treatments, and the criticisms of this was that the treatments that they were touting as, this is what we need to be teaching in all medical schools, he noticed at that time that they were very suppressive to the natural processes of healing. So for example, in wound care, he observed that wounds would actually heal naturally and faster if they were let to be exposed to air. And at the time, they were only teaching pack all of the abscess, pack the wound with moss and dung. And so that really suppressed and internalized all the infection when you should really be letting it drain. And even now, what's interesting is that if you go to emergency rooms, depending on the physician's background and understanding and teaching, they may pack an abscess or let it drain. And so it's kind of, what's unfortunate is that it often falls on, the patient to say, I don't want this packed, or I want it packed, and etc. And that's just not how it should be in medicine. There should be that, general understanding. Are we working with the body, or are we suppressing what's trying to happen? So in modern wound care, we actually had a little segment of also trained in minor surgery, and we had a wonderful lecture from this provider she only does wound care. And so she was helping us understand there are times when you want to stitch and sew the wound, but then there are also times where you might want to break that open and let it reform again if the infection continues to kind of fester within the wound. So just other examples of they were having the same conversations then that we are having now. Then on the right side, we have more so the lay physicians and practitioners, the early alternative health practitioners in Europe, Germany, and Austria within the 17 and 1800s. So starting with the far right, that is Vincent Priesnitz. He was an Austrian farmer, almost illiterate, and he discovered the therapeutic effect of cold water applications, the same thing that Hippocrates was referring to. He noticed just by observation that animals in the wild would dip their limbs in water daily. Every day he observed the same animal who was injured until they were healed. and then was able to develop his own system of localized, what we call water cure at that time, applications. Now we know that as hydrotherapy. So that's kind of what you'll see it be referred to as today. And then later expanded that to stress, more simple diet, physical activity, air treatments, fresh air, alongside water cure. His most famous patient was this man on the right side at the top here, Sebastian Kneipp, and he was a priest and also a physician. And Sebastian Kneipp was healed by Priesnitz through just water cure, and then went on to create a sanatorium, which was a facility, inpatient facility that only used water cure to cure the ill. This process of water cure essentially is referring to alternating hot and cold water applications to create an artificial circulation of blood anywhere in the body, limbs, systemically, to revive damaged tissues with nutrients, because blood is the life force of our body. Circulation is so important. And then remove metabolic waste. Any fluid in the body needs to move. So they used this process. They knew the body was going to react to this, and to kind of essentially create this artificial pumping to heal the body. By ending on cold applications, the body increases its own circulatory efforts to warm itself. And this was the key to understanding the therapeutic properties of hydrotherapy, because this natural drive towards homeostasis is the healing aspect of the therapy. It's not the cold water, it's the heat that comes from the cold water after it's applied to the body. So this drive towards homeostasis was then termed the beast, or the vital force of the body in naturopathic medicine, and that is one of our guiding principles, is to understand the vitality of an individual being. Where is it weaker, where is it stronger, how to leverage that to help the person heal. It was observed in a particularly weak or ill person that they had a much harder time and took longer to warm their bodies compared to a healthier individual. But with repeated hot and cold applications, their vitality increased over time. And then along with that, the cure of their affliction. And that's when it was understood the importance of working with and supporting this vital force. Hydrotherapy is still used in many naturopathic practices and still taught in our medical programs. In our second year of schooling, we are seeing our own patients for acute and chronic conditions and treating them only with hydrotherapy. $20 a session within our community is very affordable, and even in my own practice, I teach people how to do it at home or to do it for certain conditions. Constitutional hydrotherapy is kind of the classic form, and now that I'll explain a little bit of how that looks. You have a patient, they are in essentially lying on a massage table, and there is usually on top of a wool padding, and then essentially the therapy is to alternate cold and hot towels or sheets, and then finally end on that cold towel. And now we incorporate TENS units to increase the activity of the muscles and circulation, to kind of speed along that process. But there's so many different forms of hydrotherapy from that time period that we still use today. So it was very awesome to be able to learn that, and then to be able to help people translate that into their daily life. So one of our best examples, let's say somebody has an upper respiratory infection. The activity of the vital force is up here to fight off that illness. That's why you see redness and inflammation and pus and all of that stuff, because this is where the bacteria are procreating and creating that infection. So that is a sign that the immune system knows that there is something there that needs to be fought. So we don't always necessarily want to, from the naturopathic philosophy, suppress that process. You see it through so that the body can overcome it, instead of the example like in fevers. That's another process of the body wanting to overcome something. The body will naturally heat itself up to temperatures of 102, 103. When we get into higher temperatures, a little bit, you have to be careful with that. But 102, 103 is the therapeutic temperature of a fever. And that's what really kills off the bacteria and viruses. So if you can imagine, what we are told is to take ibuprofen, Tylenol, something to reduce the fever because the patient is uncomfortable and symptomatic. But then what happens is that now you suppress your vital force to fight that infection. It takes longer to overcome. The example with the throat infection. So then what we'll do with hydrotherapy is you apply a cold compress to the neck, and then that brings more circulation to that area. Pain relieving and discomfort relieving, but it brings more of that circulation, removing the metabolic waste, and then it really reduces the time that it takes for that person to recover. In kids, we can do warming socks, which is what they're called. So you put, when a child has a cold or upper rest, same thing, congestion, all that stuff, that the activity of the vital force is in the head and the neck. So by applying cold socks, you can bring that circulation downwards, essentially draining, but also artificially pumping that circulation as well. So anything we can do to increase circulation, to stimulate the vital force, is helping that body heal in accordance with what we're calling nature's laws of healing. Then what happened was, so Kneipp was healed by Priesnitz. Benedict Lust is a German American. He had initially moved to America in 1892, and his stay was short-lived because he came down with tuberculosis. So he ended up having to go back to Germany, and at this point, Kneipp Sanatorium was so famous that he sought out Kneipp Sanatorium specifically, and ended up being an inpatient within that facility, and Kneipp was able to heal his tuberculosis solely from water cure. He wasn't doing anything else at that time. And Lust was so enamored by that, it was like his light bulb. And he vowed at that point to share this medicine with the whole world. So he returned back to America thinking it's land of opportunity. This is where these new ideas, critical thinking can really thrive. And so that was the initial kind of forging of the naturopathic profession. So in 1902, he comes to America and adopts the term naturopathic, which is a totally made-up word, from this other doctor in New York who was also practicing more nature cure. And they got together and he started meeting with all of these chiropractors and people practicing these therapies to share water cure, but to also strengthen this movement for natural medicine in America. And so the term naturopathic was then used to be more vague. It's not just hydrotherapy, but it's any therapy that is going to support the body in healing itself. And so that allowed all of these other therapies to be taken under that umbrella. This broader definition allowed osteopathy, heliotherapy, which is essentially light therapy, balneotherapy, which is essentially bathing in mineral-rich waters, using mud to also help with skin conditions, arthritic conditions, mental and physical hygiene, and the continued exclusion of drugs and elective medical surgeries within this system. These new naturopaths that took to and really believed in this philosophy as well, they were all committed to creating health through lifestyle reform. But the current conventional medical system that was also burgeoning within America at the same time had their ideas were obviously very opposing. The conventional system is essentially allopathic, meaning that it is using treatment to suppress symptoms. That's that is the philosophy, and it's inherently opposite to naturopathic philosophy because it believes that symptoms of a disease, naturopathic medicine believes that the symptoms of a disease are an expression of that vital force and therefore point the way to its cure. And so it's not necessarily the best idea to suppress them. The opposition from the conventional setting came from a different understanding of nature and that role of nature in disease and human health, and differing views on the profitability and effectiveness of pharmaceuticals. I'm ready for the next slide. I think I already summarized this slide, but this was good. So 1910, this is termed sometimes as the year that changed medicine forever. So as Luce was growing naturopathic medicine in America, biomedicine and everything that had been discovered about anatomy and physiology was also growing. So at this time, there was more clinical research, laboratory-based diagnosis and treatment than ever before, and advancements in modern medicine, opportunities for monetization, and the inability to patent nature ensured little interest in investigating the validity of natural therapies. Funded by the Rockefeller and Carnegie Foundations, decided to commission that report you had mentioned. This man named Abraham Flexner was an educator. They commissioned him to audit all of medical education in the United States. So and Flexner himself was very much laboratory evidence science-based. So he dismissed any approach that was not rooted in what was considered scientific. So nutrition, botanical medicine, hydrotherapy, mind-body healing, all of that was labeled as quackery and unscientific, which stigmatized natural medicine and discouraged future students and practitioners. The Carnegie Foundation, Andrew Carnegie, their Johns Hopkins School of Medicine became the gold standard in medical education. So if you were not like that, then you would not receive, you would not be legitimate or receive funding. So this report alone shut down 90% of holistic medicine schools and hospitals in the US, and that affected the osteopathic profession, chiropractic profession, homeopaths, naturopaths, eclectic or herbalist schools as well, which they all lost credibility. A few schools were left, but with declining enrollment and graduates, states began to revoke or let lapse naturopathic licensure law. So at one point, naturopathic medicine was licensed in all states and everybody had access to it until this point. By the 1950s and 60s, it was nearly extinct in America. Only a few strongholds like Oregon, Washington, and Arizona, who still to this day have the widest scope of naturopathic medicine. In the early mid-century, after the discovery of antibiotics, which was the then touted silver bullet, it was so effective, allopathic medicine dominated. In 1956, as the last naturopathic medical school closed, a few doctors came together to open the National College of Natural Medicine, which is where my fiance and I went.
Sure.
So as that school closed, the profession was able to be kept alive through the few doctors that started NCNM, the National College of Natural Medicine, but as there were only medications available to suppress symptoms, chronic disease began to rise, and allopathic doctors within that system began to shed light on the limitations of conventional biomedical medicine. And at the same time, notable publications such as Silent Spring and George Engel's Need for a New Medical Model. George Engel was a psychiatrist. They brought awareness to the importance of holistic health for the community and for the environment, that these things were not separate, that we are in the environment, we are of the environment, and we impact the environment. Interest in organic farming and natural fibers and alternatives to the current medicine increased, so therefore then the demand for alternative medical education. And then in 1978, with the rise in popularity and demand for naturopathic medicine, John Bastyr and Joseph Pizzorno and other ND colleagues opened Bastyr University in Seattle, Washington. So these are still today the oldest naturopathic medical universities in North America. And since then, the NCNM, the National College, has also become a university. Next slide, please. So currently today, there are 6 accredited naturopathic medical schools throughout North America, the oldest being Bastyr and UNM now. It's important to put emphasis or kind of point out that the accreditation came from the Department of Education, so it is a federally accredited medical program, but not all naturopathic programs are accredited, and we'll kind of talk about the differences there. But currently, I think we can go to the next slide too. Currently, the first 4 years of naturopathic and conventional medical education very represent each other, or they are very similar. with exceptions in the approach to treatment. And I think that's just because now that we are in a conventional medical system, to be a physician in this system, we have to speak both languages. So I think that that was a big reason for that, in a move to legitimacy. And then going back to Bastyr University, compared to other universities, because it was started by Pizzorno, who was also very much a clinical researcher and a physician. He started coining the term science-based natural medicine, and that is what you'll see in naturopathic medical schools now. We understand pharmaceutical dosing and usage, but also receive training in natural therapies to address underlying causes of each condition. And then because we have both of this training now, we can help the patient hopefully reduce the need for medication and start to actually de-prescribe them over time in states that allow for that scope. When possible, the emphasis is always on natural therapies, usually botanical medicine, sometimes isolated nutrients, which have significant scientific research behind their use and effectiveness at this point, while because of that funding and the way that medicine developed, there is still the body of evidence for natural therapies is still so much smaller than pharmaceuticals at this point. But I do think that that is changing. The combined training is also extremely helpful when it comes to identifying potentially dangerous interactions between medications and natural therapies. For example, our beloved herb, St. John's wort, works very similar to an SSRI or a selective serotonin receptor inhibitor. Reuptake inhibitor, thank you. So a reuptake inhibitor will allow serotonin to spend more time within the synapse and work better, but so does St. John's wort. So this combination can potentially cause what's called serotonin syndrome, and symptoms of which are hypothermia, muscle rigidity, myoclonus or jerky movements, rapid fluctuations in mental status and vital signs, because that is the effect of too much serotonin in the system. With a large number or percentage of Americans on medications, and overlapping with an increasing demand for natural intervention and a lot of self-prescribing, we need providers to be looking out for their patients and checking in about medications and supplements routinely. I can't tell you the number of times I've maybe made recommendations and then maybe 2 weeks later they read something online, and I don't blame them for it. They want to try things and they're so curious and intelligent, but we'll get together and and it's like, okay, now we need to look at what are the actions of everything, because even one herb can have multiple actions. Imagine taking a formula on top of a supplement, and then it's a lot on the system. So it's so important to continue that dialogue, and also importantly to have a good relationship with your patient, so that one, they trust you to share that information, and two, so that you can work together on figuring out a treatment plan that resonates the most with them, that works the best with their body. So I appreciate having that conventional medical training, even though I could always use more training in natural therapies. Another interesting difference is that, one, in clinical nutrition, so even though our didactic and clinical hours are comparable, over 4,000 hours for DO programs, MD programs, and ND programs, we still have by far the most training in clinical nutrition and then natural therapies. So at this point, it's a little bit different, where out of maybe 2,000 hours of didactic training in allopathic medical schools, they might have now maybe 4 or 6 hours of nutrition, which is more than it was before. Before it was 0. So that's a huge difference, which is really important considering if you believe that diet makes a difference in your health, and yeah, it does. And then the other biggest difference, which I thought was interesting, is that in naturopathic medical schools, we start our clinical training sooner than in allopathic schools. So I started seeing, my fiance and I, we both started seeing our first patients in our 2nd year, and that's when we were doing only hydrotherapy. That was like what they felt comfortable with us doing. And so we would be seen with an attending physician, but we would see our patients one-on-one. We would do the therapies one-on-one, and then the attending would check in before and after. And that is very similar to what allopathic DOs and MDs do in their residency program, which is 4 years after they've graduated school. And going back to kind of Paracelsus and early physicians, experience is paramount, and time and experience and meeting with patients. You can only read so much, but you have to be able to really implement it and observe it in real time. So I did appreciate that as well. Next slide, please. Yes. So I wanted to just point out again with training that there are naturopaths and practitioners that refer to themselves as naturopathic doctors, but that don't necessarily go through these accredited programs. And I think that's important for patients and just people to discern based on what you're looking for. So the biggest difference is going to be in hours of didactic and clinical training. 4,000 hours versus 160 credits over there. And that's a similar difference between MDs and DOs and then like nurse practitioners or PAs. So it is quite different. And then same thing with clinical training, minimum of 1,000 to 2,000 hours of seeing patients prior to graduation, whereas when you graduate from a certificate program in naturopathic medicine specifically, they don't require clinical training, or it's maybe like up to 40 hours. And Trinity School and University of Natural Medicine, those are the ones that are probably the most common, most popular certificate programs. So this is not to throw shade on certificate programs at all, because I would say in some respects, I'm sure some of these programs have a different perspective, or their knowledge base within natural therapies could be comparable or even better in some aspects. But I think that because these programs certify doctors of naturopathy with only a small fraction of the training and credits that an average doctoral program has, I think it's a little misleading and creates confusion. And it brings up the role of licensing laws to distinguish these differences clearly for patients that are seeking a holistic provider. I think that's so important, because just in my practice and in my experience, I feel like there's so much onus on the patient, and the more that we can take that pressure off, like I'm a huge proponent of advocacy, patient advocacy, autonomy, informed consent, and I just don't think that the confusion in medicine in general and the responsibility or the effort that a patient has to go through to seek and then identify and know if that natural therapy works for them. This is what alternative providers are here for. I know naturopaths that didn't go to an accredited program, and many are elders to me, and I've learned so much from them. And this whole accreditation process happened way after they were trained. So there are opportunities for them to get that licensure, but like some don't want to. And why? They have so much experience. So there is a caveat with that. I only say this to point out that there is a difference. And when you're looking for a provider, I think the most important thing to me is transparency of training and clinical experience, so that when you identify what your health goals are, that they're well matched with providers who can serve you safely and then effectively. I've also seen other non-naturopathic providers in this area who have taught me more about medicine and healing than 6 years of formal medical training could do. So, everything is an experience, and just continuing to absorb more information and develop myself as a healer from anyone. I think there are a couple instances in where a person might want a medically trained naturopathic doctor versus one that's certified, and that's mostly with that case use that I was talking about earlier, where if somebody's on a polypharmacy, a lot of medications, and they want to treat themselves with holistic or natural therapies, that provider already has the scope, licensure to manage their medications and manage their natural therapies, and it reduces the need to be seeing many different providers. So that's one instance, but ultimately it's whoever you connect with the best and who's going to be able to properly care for you. Okay, next slide. So the current scope of naturopathic doctors in the United States is illustrated by this map here. So everything in blue is where we have actual legal legislation to regulate our profession, and my license, I still carry a license as a naturopathic physician, so I'm licensed as a primary care physician, and that license is, my license is in Vermont. So in the United States, every regulation is state-based. And so all the blue states will have some form of licensure. It's that if you attend an accredited program and you take the board exams and you are able to obtain a license, you can register yourself as a licensed naturopath in Pennsylvania. And that's the same thing as kind of like title protection, where people can discern, okay, did you go to an accredited program or did you get your training elsewhere? Currently, 23 states plus DC, Puerto Rico, and the US Virgin Islands have some licensing or registration laws that include Hawaii and Alaska. So the scope as a primary care physician allows me to prescribe medications, perform any physical exam, perform minor surgery, diagnose and treat medical conditions in addition to the use of natural therapy. So it's kind of I'm an integrative physician in one. And then this also helps fill a need for primary care providers as we're seeing more burnout and demand in this field. And then the most limited scope is in unregulated states like Virginia, where we don't have the ability to take insurance or sign lab orders or perform physical exams or formally diagnose or treat any medical conditions. And that doesn't mean that we don't also share our knowledge. I diagnose or treat, I can still practice all forms of natural therapies because these types of therapies are not necessarily regulated like pharmaceutical. So things like herbs and supplements and homeopathy are widely available without a prescription. I'm just able to provide my knowledge on how to use those things at a therapeutic level for a certain condition, which is maybe not widely understood, so that my client can understand how to use that for their condition specifically. So there are kind of ways around that where we're not practicing medicine, but I'm sharing information almost as a wellness or health consultant. Oh, okay. It's important that in these states, again, there's no licensure law regulating the medicine here, so it's really on the onus of the patient to understand who they're seeing. So I hope that today, in knowing all this information, you kind of better know what you're looking for, who you're getting, and then I hope that providers as well are also being transparent about their training. If we sometimes, because of the limited access to alternative practitioners in unlicensed states, we get a lot of Dr. Google and self-prescribing. And just in my experience, it can be dangerous in some cases, leading to the wrong treatment or wrong diagnosis. And for example, I've been stool testing for like 5 years now, and I'm pretty confident we don't all have parasites. Like some people do, but not everybody has parasites. And then, for example, someone came to me thinking they had parasites, but they actually had candida. And parasites and candida, which is a fungi, totally different organisms, totally different methods of treatment. So that's another reason why it's just so important to, if you don't know what you're doing, get a second opinion. I think, last thing about that, or would you mind going to the next slide, please? Before we get to the guiding principles, due to the variance of scope in the country, no two NDs or naturopaths or holistic practitioners are exactly alike. But examples of NDs that are at the highest scope in integrative settings would be like Cancer Treatment Centers of America, the AMIN clinics, psychiatric clinic. So these are where MDs and NDs will work together on specific conditions like cancer, PTSD, schizophrenia, things like that. And those are honest. And I was able to shadow at the AMIN clinics. It's really, really wonderful how they've been able to really work together. And then universities that also have an integrative health clinic like UC Irvine, Wake Forest in North Carolina, and then George Washington University as well as a center of integrative medicine. And then you'll have private practices across the entire country that will have different scopes based on the state that they're in. Okay. So the guiding principles of naturopathic medicine, this is what brought me to this medicine. I really loved that there was a philosophy that resonated with how I felt like the body works, and starting with first do no harm, which you'll see in any medical provider's oath, and that really means to utilize therapies that cause the minimum side effects, minimum risk to the patient, to diagnose and treat, and to always acknowledge, respect, and then work with the individual's self-healing process. Identify and treat the cause, like this is a guiding principle to seek and remove underlying causes of illness rather than to suppress symptoms. And then we're also guided by the healing power of nature, or the vis medicatrix naturae, which is that inherent healing process that is ordered and intelligent, so it needs to be respected. We act to identify, remove obstacles to healing and recovery, and then facilitate and augment this self-healing process. Doctor as teacher. This is probably one of my favorites. I think I have an inherent love of, oh, okay, you came in with reflux, let's talk about the entire digestive system. Because when I got into this, my goal was to teach people how their body works and how to take care of your body, and I think that's the right of every individual to know how this, physical being that we're in this lifetime temporarily, like you get to know how that works, and you get autonomy and sovereignty over that. That's, I think, a right that we have. So we educate our patients and encourage self-responsibility for health, and that's physically and mentally, emotionally. We treat the whole person, always considering the person's physical, mental, emotional, genetic, environmental, and social and other factors. The total health includes spiritual health, and so naturopathic physicians also encourage individuals to pursue their personal spiritual development. Prevention. This is the main goal of naturopathic medicine, is to prevent disease. And prevention of disease and then optimal health. These are the primary objectives of naturopathic medicine through education and then promoting healthy ways of living. And then how we do this is through the understanding of what we call the therapeutic order. So this is really guiding our treatments and understanding of where the person is at in terms of their disease. So if we think of health and disease as a spectrum, then if somebody is closer to that state of health but maybe slightly moving into the imbalance of disease, we can work more in the lower levels of the pyramid. But if someone is, say, coming to us on a lot of medications, they've already had organ removal, then maybe we're working at the higher levels, but always bringing in these lower levels. So I love this definition. It's a set of guidelines that helps us resolve the person's symptoms and address underlying causes while using the least force necessary. So we are always trying to work with the body wherever that person is. So often with every single person I work with, we're always working in establishing foundations, nutrition, diet, nutrition, lifestyle, so sleep, stress management, exercise and movement. If those are not in place, you will always be working within the orange and red area, because there is almost always going to be a need for managing symptoms. And that's often where we get a lot of our cases. I think in other reasons for that are also because we're kind of so fringe right now that we get a lot of cases that are chronic, complex, a little bit more severe, because they've seen all kinds of conventional providers. So we're getting them already kind of in that upper pyramid, but that's okay. We can always use the entire pyramid to help restore their inherent systems. The belief that we always have and carry with us is that the body is always trying to move to a state of health. So any way that we can remove an obstacle, whether often it's like poor diet, or honestly sometimes it's like they drink a little too much each week, then talking to them about that, educating about that, just helps that process along, regardless of kind of where they are in their health and healing. Next slide, please. Okay, so these are the modalities that you will typically see within a naturopathic practice.
it started off as a lot of nutrition, lifestyle counseling, hydrotherapy, and then like mudding. And then when Luce came to America, he underwent chiropractic training. And so a lot of physical manipulation techniques were incorporated into naturopathic medical schools. The one school that's in Indiana near Chicago, they're actually a joint chiropractic and ND school, because when we think about how the body works, one of the core tenets is the skeletal system. So if there is not alignment within the skeletal system, then the nerves that pass through that system won't necessarily function as well. And those are most commonly, like the most pathological sense would be like impingement or nerve damage, osteophytes, hip pain, things like that. So there was also a belief within chiropractic medicine that we kind of adopted in naturopathy as well, that each level of the spine also had mental, emotional connections as well. So always looking at, where these systems coincide and different therapies that can address that. Deborah was sharing also about Rolfing. Rolfing is one of those things too that looks at not just the physical structures, but how that coincides with mental and emotional. So physical manipulation means more than just a high velocity adjustment. Then botanical medicine, Western herbalism was adopted as well, and then homeopathy. Homeopathy was kind of discovered in the early 1800s by Samuel Hahnemann. He in Germany. And he discovered that potent dilutions would help also work with that vis or natural force to push the body in that right direction. So we could spend a whole presentation on homeopathy, but I want to just kind of bring it in here, and I'll bring it back as well. But just that it is a cornerstone of naturopathic medicine at this point, because it is so inherent and aligned with the philosophy of naturopathic medicine. Nutraceuticals is very new compared to our other cornerstone therapies, because now we have the ability to isolate certain nutrients from plants and herbs, and this is actually very pharmaceutical in that sense. So there is now a type of practice that we call green allopathy, where I'm weary of it at times, because we might have the same training. There are naturopaths that will practice in this way. And then there's some that practice more so with the traditional ways. We call them vitalists. But the ones that kind of use supplements, but then we're using supplements to suppress symptoms. So it's not nothing is a perfect system, but to understand why and how, and like how long are we going to do this for? Are we also addressing the foundations? This is why we always go back to that therapeutic order. Are the foundations in place? Is this like a temporary use? So this is another tool that we've like kind of adopted into the toolkit, but is not as holistic in that sense in some cases. But very, very strong evidence for certain conditions, like the research is very interesting. And then pharmaceuticals and minor surgery as needed in extremes if you are practicing under that scope. And then for me personally, if that was my scope, I would be using for deep prescribing, things like that. Okay, next slide, please. Okay, so I finished my residency here in 2022, and then I opened my own practice called Mamta House. Mamta in Hindi means a mother's love. This was actually supposed to be my original name, but actually through experiences with people that I've met in IONS, this name kind of came back to me as this really powerful energy of love and healing, and something that just resonated so deeply with me and coincided with energies of like Mother Earth, and how this very powerful, unconditional, strong love, like there's so many adjectives that I felt was embodied by this word, so I chose that to kind of name the practice. But our approach is guided by the naturopathic principles, and then I've also integrated my own experiences, my journey into my own spiritual health and well-being, and helping share that with my clients as well. We focus on the foundational levels of the therapeutic order, so we do so much of the nutrition and lifestyle. My fiance and I are getting into fasting. We want to develop natural programs of weight loss, especially in this time period where GLP-1s are so popular. GLP-1 is funny because this is a medication that is really helping in the obese populations and people that are at very, very high risk for cardiovascular disease, which continues to be a leading cause of death in this country. But the interesting thing is I'll receive clients who have been on them for so long, things like now not as many people still use Ozempic, not as much now that we have the injectables, but the ones I was receiving on Ozempic, really high side effect profiles, like nausea, vomiting while you're taking the medication. And then when we look at the mechanism of action of a GLP-1, it is meant to be slowing down digestion so that you don't have as much of an appetite, so that you stop eating as much. This is like the same way of thinking of a lap band procedure or a stomach resection, where you're reducing your own digestive capacity so that you won't eat more. When really what we need to be talking about is like retraining our receptors and our digestion, and maybe doing a fast of some kind to help with reset the body's inherent ability to manage its own hunger and satiety cues. That's really what we're trying to do, and it's just different ways of thinking about how to do that. So often I'll receive people on PPIs or GLP-1s, and we have to spend a lot of time with repairing that digestive system, because we want the person to be able to use what the universe has given them to manage their own health. So this all goes back to our just desire and drive for patient autonomy. My fiance and I talk about this all the time, that I'll love when my clients never see me anymore because they don't have to. So that's what we're trying to work towards, is to just educate, and help people help people understand how to balance themselves. Okay, next slide. Okay, now I can talk about all the fun things. So these are the modalities that I love to use personally. Of course, diet and lifestyle are paramount, physical modalities. I love herbal medicine. That is also another talk in itself. If you and I'm sure many of you know, when you're an herbalist or a homeopath, that alone is a lifetime of study. So I feel like I'm a young Padawan in exploring all of the modalities that I love, and so early in practice that I feel I'm still even looking to explore new modalities. And right now, my my passions right now are homeopathy, craniosacral therapy, and then dream work. So I incorporate a number of these modalities, sometimes all, in my clients' care plans. Conditions that we tend to see right now, I contract at a digestive health clinic in Charleston, and we see a lot of IBS, SIBO, functional gastro intestinal diseases, constipation, diarrhea, people on PPIs, GERD, reflux, all host of digestive issues. I love digestive issues because of my experience within the Ayurvedic system. Your digestive tract is your barrier between the outside and the inside. Everything that goes from your mouth to your anus, this is like your first line defense. It is the one system that we have so much direct control over every single day. And this is another reason why nutrition is so important, because everything you put into your body, and this goes not just to physical things, but air, water that you bathe in, the thoughts and emotions that you digest yourself, all of those things go through this system. So I love this because it heals very fast, it changes overnight, and it's just really, I don't know, it's just my thing. I love talking about stool, intestinal, things, yeah, so I just love it. And herbs, like bitter herbs, and there's so many, the earth gave us what we needed to help to fix the system. So I just gravitate more towards the digestive disorders. But we do see a ton of chronic disease. I get a lot of hypertension, diabetes, weight management, metabolic syndrome, high cholesterol, the whole other topic as well. skin conditions, and then just because of the nature, I think a lot of women too, especially in that area, seek natural therapies. So we do get a lot of people who want to do hormone balancing, which is funny because I think there's always this disconnect between like expectation and reality. What is hormone balancing? My first question is, okay, first of all, what are your symptoms? And then is that indicative of a hormone imbalance, or does it overlap with a digestive disorder? Does it overlap with a chronic condition that you've been struggling with? Does it overlap with anxiety or depression or adrenal dysfunction? So all of those things we explore together. HPA axis dysregulation, this is the correct term for adrenal fatigue. So I think there's that misnomer where adrenal fatigue is really referring to Addison's disease that has to be diagnosed by an endocrinologist or anyone who orders that blood work and has the license and scope to diagnose it. But the correct term for essentially chronic and increased cortisol response or stimulation, eventually the adrenal glands that produce your cortisol for the stress response are going to get tired. And when they get tired, they start to tap out. So people who may not realize they're going through this are often my chronic coffee drinkers, because coffee and caffeine will stimulate cortisol to increase, and then you can't really tell. Maybe over time you realize, oh, I'm drinking 1, I'm drinking 2, maybe 3, and then as soon as you stop, that's when you get all the withdrawal symptoms. That is what I teach my clients to understand. That's your adrenals tapping out, and that's actually late stage HPA axis dysregulation, referring to the signaling pathway for that cortisol to increase. So that starts in the hypothalamus. And what starts before that, which I love to emphasize, is your perception of stress in the environment. So if you perceive something as stressful, your hypothalamus cannot tell the difference between an emotional, mental, or physical stress. That will signal the pituitary gland to signal the adrenal glands to increase your cortisol. So that is the most correct term for that, and we work with people through all stages of that. So we do testing, we do functional testing on people's cortisol or adrenal rhythms to see how late in that stage are they. So I'll have people that their cortisol is through the roof throughout the day, at night, or sometimes their cortisol doesn't spike in the morning. That's also a problem. Or their cortisol, instead of spiking in the morning, spikes at night. So all of these things we have to assess, and we assess through symptomatology, but then also objective findings. We do that combination and integration of the methods that we have offered to us. I don't dismiss that because it wasn't part of our roots. I think if we have it and it makes sense, then why not use it? So I do a lot of that. Sleep disturbance kind of falls in that category. And then more and more now we're seeing cancer on the rise, Lyme disease, and mold illness. These mold illness used to be kind of scoffed at as a diagnosis, and is still not technically a diagnosis, but people who have been exposed to water damaged buildings for a long period of time. I actually testified in the Richmond public schools in Chesterfield County because a lot of our elementary schools have been water damaged, and only now, not now, but in the last few years, are these counties testing for mold, specifically toxic mold within the ventilation systems. And I would be in that building, and having gone to medical school in Oregon, there's mold everywhere. So I started to become more sensitive to it. And when I was actually working as a math tutor in some of the buildings here, I would feel oh, my symptoms, I'm starting to get more sinus congestion and things. Someone should check this out. They were actually testing for mold around that same time, and then someone approached me to speak and testify at the hearing or whatever for the mold testing. So this is a significant risk for our kids who are spending day in and day out 8 hours in these schools constantly inhaling these toxins. And it's just crazy that we haven't done more to remediate these buildings and provide alternative online school, do something, because more and more people are not, realizing that they're constantly having to process these toxins. And the thing about mold illness, why it's so dismissed in medicine, is because you typically, we're all exposed to it, indoor, outdoor mold, it's everywhere pretty much, to some degree. But we have the ability, like our liver can still process that and detox for us, but 25% of people will be affected and not be able to do that detox process as effectively. And we're still trying to understand, is that, you know, an enzymatic issue? Is that more chronic? I think it's a combination of those things, but this is, Lyme and mold are probably one of the most expensive chronic diseases and most under acknowledged and you know, not covered by insurance. And what we're seeing, at least in the functional space, is that when we're doing testing in a conventional setting, you may not show up positive for Lyme antibodies, but on a functional test, we're looking for tick-borne illnesses as a whole, Rocky Mountain spotted fever, like other things that are co-infections with your typical Borrelia, Burgdorferi, Bartonella, and those are coming up extremely positive. So this person still has some type of tick-borne affliction, but you know, we're missing it, and then that causes neurologic symptoms. People become paralyzed if they have an untreatable or untreated tick-borne illness. So anyway, we do see a lot of that within the naturopathic and more holistic space, because they go through, again, conventional settings, and it's maybe caught or they get false negatives, they do antibiotics, but I think in any case, regardless of what the condition is, if there needs to be medical intervention, I think there's always an opportunity to do holistic treatment as well. So we do see that, and then I often work with conventional providers if I'm in a place like Virginia or South Carolina that doesn't allow me to prescribe antibiotics when we need to in Lyme. Then I'm working with them to help them understand these are protocols that I'm familiar with, that my mentors have taught me, and we do that in conjunction with supplements that support the detox process. So the person isn't just on antibiotics, they're also on things that, on probiotics at a certain point, or they're on electrolytes or certain herbs and things like that that are going to address the infection without totally harming the body. The first thing, do no harm. So if your therapy, if we cannot help it, if it's surgery or medication and is going to provide some XYZ side effect profile that will harm the patient, then we need to also do things that are going to mitigate that effect. So those are probably my most complex cases, but we do the best we can, and I think that, and I'm not a Lyme and mold specialist, but there are a lot of my colleagues are getting, you know, very deep into this. A lot of MDs, DOs, like more people are aware of this issue now, and so we have a lot more resources. Okay, next slide. So these are my favorite therapies that I am currently kind of diving deeper into. Craniosacral therapy was originally developed by osteopaths as a branch of cranial osteopathy. So osteopaths are traditionally a form of holistic providers that work primarily with the spine, and now, because honestly past the Flexner report, they needed to also be considered legitimate. So MDs and DOs practice very similarly in this day and age, but this is where, you know, their origins are. This system is different than the structural skeletal system because it works mostly with the fluid system of the nervous system, which was new at the time of this understanding, because no one had observed until there was an opportunity to do open. They were removing John Upledger, one of the osteopaths who learned from a previous osteopath about this technique, was removing a calcification with a neurosurgeon for a totally different case. And as they were cutting open the dura, which covers the spinal cord, so you have the spinal column here, and then here's a picture of that. So when you remove the bone, after that will be a thick layer of connective tissue called the dura, and that's what protects the spinal cord. In between these connective tissue layers is a fluid called the cerebrospinal fluid. And that fluid is bringing nutrients to the nervous system and removing metabolic waste, and it pumps regularly. It is a different rhythm compared to the respiratory rate or blood circulation. And what they observed during that surgery was that the nervous system was moving. And this is what was understood then as the craniosacral rhythm. And so now we've developed essentially a form of body work that assesses that rhythm and removes restrictions in the flow of the fluid as well as the movement of the cranial bones. So it was also thought that because the bones fuse together after we're, when we become older, that the bones don't move. But because of the understanding of this movement within the nervous system, the bones of the skull have to breathe essentially to allow for that movement. Otherwise, we will constantly feel pressure headaches. So that the bones do move in response to the changes in fluid and pressure. And the applications of that have been extensive. So really commonly we'll see migraines, headaches, chronic pain, and even in systems that are not nervous system or pain related, because when we think about the central nervous system, you have the brain, then you have the spinal cord. All of that goes from the skull down to the sacrum bone, which is this bone in between your hip bones, like the lowest part of your back. And every nerve in the central nervous system will exit through the spinal column. Then after those nerves, they branch into every single part of the body. So essentially this system governs the structure and function of your entire nervous system, thereby all of the systems in the body, because your nervous system is governing all of the electrical signaling within the body as a whole. So I have loved using this therapy, exploring this therapy. I have personally benefited from it. There's other applications that are mentally emotional. So I'll share some personal experiences that on the table with clients, the way that this therapy works, it is so subtle. The first thing that you have to do is connect with the body. And this therapy is so profound because as we were training, you really feel the vis, you feel the person's inherent desire to heal, you feel that movement within the body. And then you can hold space for that. You hold healing intention. You're actually compressing fascial layers to such a slight extent that it's just giving that light signal for the body to start correcting itself. And we can really feel that. It's really quite incredible. So in some of my client sessions, I will feel physical releases, and sometimes I'll feel emotional releases, or afterwards when we're kind of debriefing, they'll share with me, I had this vision of XYZ, and it just offers this beautiful doorway into exploring not just physical pain or physical symptoms, but the connections between that mentally emotional, and that's really where my passion lies, because I think we all kind of understand that everything is all connected. And it's so nice to meet other practitioners in here and just in life that are exploring that in different ways. And I think this is my way of doing that. And I'll see it in my clinical practice, and I just love how it overlaps. I think one of my favorite examples is when I'm working with someone with leaky gut or intestinal permeability, and their actual intestinal barrier is leaking fragments of food or antigen, bacteria, whatever, and their immune system then responds to that. So they get a lot of food sensitivities and blah, blah, blah. They have poor boundaries. And then I'll talk to them, do you feel, or how do you feel about boundaries, your relationships? And it just kind of comes out as we're getting to know each other that it matches, that they have physically poor boundaries and then mental and emotional poor boundaries at times. They'll often be like over, in a caregiving role for too long and never pouring back into themselves, or in bad relationships. And then we'll finally understand, the pattern is we need to stand up for ourselves, something like that. So I'm obsessed with this connection, and this is kind of where we're taking, at least where I'm taking that in my practice. Obviously combining that with the foundations. Everything is important. Next slide, please.
I don't know. I don't know. Thank you. I don't know if you know this. Craniosacral therapy was developed by Jean-Pierre Brault in France.
Mm-hmm.
So his heir apparent was Didier Pratt. That's the one I studied with.
Wow.
Okay. And you talked, just in case you don't know, you talked about the pulse of the craniosacral system in the average adult, it's 8 to 12 pulses a minute.
Thank you.
Sorry.
It's okay. The other therapy I love to use to, again, work with this force is homeopathy. So this was discovered by Samuel Hahnemann in 1840, and at that time he was, I don't know, honestly, I don't know how he came up with the idea to do this, but he would take natural substances found in nature, so a plant, mineral, animal derived substance, and dilute it to the 100,000 million times until he would get a solution that was almost like water. And this is kind of the argument for homeopathy today. They're like, oh, well, there's nothing in it. But now that we know more about homeopathy, we have things like scanning electron microscopy and electromagnetic imaging, we can see that even though it's just, the solution is clear, there's nothing in it, you can see some nanoparticle within that substance. And those substances he found were medicinal. And how he discovered how to use that substance is by giving this dilution to a patient who is healthy. This is what we call provings. We don't really do these anymore. But he would give these substances, and that substance, after a certain period of time, would produce a certain disease. And then he realized this dilution of a substance, let's say it was homeopathic salt, like table salt, that would produce a certain set of symptoms, and that's how they identified this is the symptom picture of that natural substance. So if you gave that dilution, and one of the most famous examples was malaria. So they would give to someone who had malaria, they would give the homeopathic dilution of the bark, the quinine, and that would cure the malaria. So they were curing malaria with homeopathics like back then. One of the most famous contributions Samuel Hahnemann had in the United States is he came here, and then there was the 1918 Spanish flu, the flu epidemic, and there was a lot, obviously, it was very tragic for the community, and conventional medicine was not proving to be as effective. So he went out and he treated so many patients with homeopathics, and so much so, he had 100%, from the documents that we have, he had 100% success rate. They actually memorialized him for his efforts in Washington, D.C. So you can still go and see his monument because of his efforts at that time. Lots of documentaries out now about homeopathy that I think have been very influential in understanding it. Prior to that, the explosion of homeopathy and homeopathic education in India. Now there's more homeopaths in India than kind of anywhere else in the world. So it's really quite a profound therapy. Just One Drop was a documentary that we had to view in school, and that was about the use of homeopathy in autism or in children. And you would see, I think seeing the case analysis and the direct experience of these people and the effect that homeopathy had on them is, I think, the most amazing. You would see these children that were nonverbal after months of treatment start to, you could tell, increased sense of well-being, happiness. They were verbalizing their emotions. I mean, parents just sobbing, like it is crazy. And the applications are endless. There are over 17,000 known homeopathic remedies, and so many, that we don't know, we haven't discovered yet or understand their symptom pattern. But applications in all forms of physical illness, cancers, infection, localized injury, mental emotional. I think this is one of the most profound therapies for mental emotional illnesses, especially in a landscape where we're using a lot of pharmaceuticals and there's not a lot of alternatives. That being said, the caveat, if someone is bipolar and they're under the guidance of a psychiatrist, they're on medication, I'm not saying at all that, discontinue that immediately and take homeopathy. Always consult with your provider, but these can be really nice adjacent therapies, and then you just see how the body responds. In the best case scenario, there might be a reduced need for medication or a true cure of the illness. There's a film coming out too called Introducing Homeopathy. So keep an eye out for that. And then those two films, Homeopathy Around the World, you can just search on YouTube. And then Just One Drop, I think you can look up as well. This is the most recent therapy I've really gotten into. I started lucid dreaming in college just for fun, just to see if I could fly or do certain things. And that was a very, I didn't know how vast this therapy was until more recently. In the last, I think, 4 years, I've started understanding it as a practice of self-inquiry, self-development, spiritual enlightenment. And that's, I think, because, at least in my understanding, that if there is an inherent desire to heal itself, if the body is always driving towards homeostasis, then there is an intelligence within me, within you, within everyone that is working towards that diligently, and that the subconscious and unconscious are no exception to that. And what's awesome is that every night you have the ability to connect with that and see what it is saying to you. And these are, I can't even begin to describe how profound this has been within my own health, and then stories I've heard as well of people that have used dream therapy. When I was kind of studying this more in depth, there was one case where this man had reflux for 30 years, and he just suddenly tired of being on antacids, and he did a dream group or something with, I can't remember who the teacher was, and his teacher was like, you can ask for guidance within your dreams. So at night, however you want to do it, there's lots of different ways to do it, but you can just simply, without anything, just ask, how do I heal from this? And he went and he said, I want to heal from my reflux. Pure intention. In the morning, he woke up, no reflux, and never had it again. And I was blown away by that. So I started to inquire, what's going on? What's in here? Where else can I heal? And that really helped me shed light into dream interpretation, and then teaching people how to do that for themselves. So in this study, I found a lot of people who will use dream dictionaries, which are interesting and helpful, but kind of going back to where does everything come from? If it's a book that's being written, where does it come from? And so every book that was written about it, or a dictionary, you have to understand the lineage and how this person wrote that. It was from a specific perspective. So if you latch on to that specific perspective, your dreams will almost reflect what that person is saying about that. It may or may not be inherent to how you actually feel about the dream's meaning or that interpretation and application within your life. So I kind of took the other branch of thinking and study around it, where I really believe that you are the authority of your own dream's meaning. And my job as a practitioner, and it's so similar with a homeopathic intake, is to, through inquiry and curiosity, help that person understand more about themselves. So I have two interesting cases where I just decided I'm going to start doing dream work with people. And so I had a couple of people who were interested in doing that, and they were dreaming vividly at the time, which is helpful, not necessary, but helpful. And they were sharing with me a dream about, and I know this person already, so she was awesome mom and always caring for everybody else, and she knew those things about herself. She knew that she needed to do more about self-care. Self-care was always something we were talking about. How can we incorporate breath work or meditation, or where can we rest your body because it needs it? There was a lot of physical symptoms as well. So she shared with me a dream about envisioning a corridor with a lot of it was a house, and she knew that it was her house. And then in that house, there was a huge annex where she was it was my Zen space. It was everything I wanted. There was so much clutter and things everywhere else. And I was just oh, that's really interesting. When you went into that room, how did you feel? And she was I felt I need more space. And when she verbalized that, she it hit on a different level than us just talking about, you need to meditate 15 minutes a day because you really need it. this was like, I need to do this for myself right now because my body is like clearly crying for it. So that's just like one example. Nightmares are very interesting because at least what I've been reading and learning is that nightmares are, your body, whether it's a physical symptom, mental, emotional symptom, your body is always trying to tell you something. And if it's a nightmare, especially if it's a recurrent dream or nightmare, your body is just constantly upping the signal, like you need to pay attention to this, you need to pay attention to this. And that's why it's so frightening and intense and extreme, because there might have been earlier signs, years ago, whatever the case may be, where those signals might have been subtle, and now it just needs to be strong enough that you can start to pay attention to it. So I will help people understand that, and I've even done this with myself, but tips and things to work within the nightmare, ultimately you have to face what you're afraid of. And what's interesting about nightmares, whether you have to face a person or an animal or whatever it is, this is an expression of your unconscious or your body's ability to heal itself, your higher self, your inner physician. And by just turning towards it, you can ask it, what do I need to know about this? And in a nightmare, it's very hard to do that. I've definitely woken up in nightmares trying to face my whatever it is. But when you do that, you get an answer. Like, you can get an answer in English. Like, this is what it is sometimes. And it's just a matter of like, are you ready to like dive into that? Because as soon as you look towards the direction you want to go, your body, the universe, everything meets you at that level. So you might get insight in an image, like it can just be a picture. And then by just exploring what is this imagery, what does this symbolism mean to you, this is helping you understand it could relate to something in your life. Just think about the connection. My job is not to tell people what their dreams mean. I think that's sometimes, I would say the exception is when you're working within a dream group. Sometimes it's interesting to see what resonates with other people. I've done that and it's definitely been helpful. Like this other person in the group, I don't really know them, but when I say my dream, like when I'm trying to orate like exactly as many details as possible, it'll resonate with them in some way. They'll share something and I'll be like, oh, that doesn't make sense. Or sometimes it's like, oh my God, that's it. A client shared a dream about a cult leader, and she was also going through a divorce. And so it was interesting because the whole process was being dragged on, but in this dream, she identified this cult leader as someone who was trying to manipulate her, and she needed to really run away from that. And the exploration into that symbol, I was just, you can start even simply, what does a cult leader mean to you? And what's interesting about cult mentality is that the cult leader is often very charismatic. It's very easy to be enamored by what they're saying. What they're saying makes sense on some level, and somewhere resonates with you, and the way that they, present that information is very enticing, and you feel like you're in a community in XYZ. She did not have that. She was like, a cult leader is a manipulator. And this person, I'm trying to get away from that. So instead of her initial perspective was that this whole cult situation was that she was trying to get away and she was in a bad situation, we helped to reframe that mindset that think about how special it is that you were in this cult situation and knew that this was not good for you. And you knew that you needed to get away from it. And it just it was all entangled in this discussion that we were having about we need to do the things that are right for us because it's for the health and well-being of you and your family. And so I love bringing in dreams because I could never tell her that, like in that way specifically, just in regular conversation. It was through the imagery that was coming from within her to where that really developed into that deeper rooted conversation. So anyway, I love dream work, craniosacral therapy, homeopathy, and I'm enjoying the exploration into natural and holistic medicines through direct experience and guided by that ultimate principle in naturopathic medicine of the body's inherent ability to heal itself. So I do not look like your average naturopathic physician, I can guarantee that, but I love it. And even though I'm a naturopathic physician, I would just say I'm a holistic healer, and I think that that's the most beautiful thing about alternative and holistic health, is that we all have our unique gifts and what resonates with us, and that's your gift to share with people. Thank you.
I wanted to share something that really opened my eyes about naturopaths. I went to a talk on the thyroid by a neurologic chiropractor, and he was so well informed. And I would love it if our MDs had half as much learning as naturopaths do. Anyway, after his talk, he gave us an opportunity to have an hour of his time at a reduced rate. So I went to see him. He said, I want you to do 3 things, and I want to watch you do them. I flunked everything. He said, I think further testing is necessary. So he sent me to LabCorp for further testing. Diagnosed stage 3 kidney disease, fatty liver disease, and I had thyroid disease. So anyway, he said, I want to put you on a nutritional detox plan. I told my MD, and my MD said, are you kidding me? He said, you think you're going to heal from using food as medicine? He said, come see me in 6 months. So when I did, everything was healed.
Wow.
So then, silly me, I celebrate by reintegrating sugar. 3 months later, of course, the fatty liver was back, but I didn't have the resources to buy a detox plan. And I had heard many naturopaths say that we believe that emotional health is 85% responsible for disease. So I thought, you know what? I'm a rapid transformational therapist, and that's what I help my clients do. We get rid of emotional root causes. So I'm going to do that as well as my food detox plan. I did that, and once again, it was healed.
Amazing.
And I've also healed some other things without medicine. And so my whole wish is that these physicians get as much training as you do, and that people take their own power back in terms of their own healing. But I really salute naturopaths, because you're such a positive force for helping all of us. So thank you very much.
Thank you for sharing your health journey.
You're
It's
welcome.
Stories like that, we need more of that direct experience, personal evidence. So that was thank you.
Thank you.
Can I ask you a question?
Yeah.
Okay. Should I go ahead? Okay.
Yeah, yeah.
Hi, Shruti.
Hi.
Good to see you too. So I'll just say that if it wasn't for naturopathy and functional medicine, I probably wouldn't be standing here. So let me just say that. But so I had this experience getting back to abscesses and letting wounds drain.
Yeah.
I've been traveling back and forth to North Carolina with my husband for his work, and I had this insane abscess, and I had to go see an endodontist. And I said, can you just pull the tooth? And he said, no, we have to save the tooth. I was like, okay, whatever. So they drain it and do the thing, but don't do the root canal. And then the next day, randomly, or not so randomly, if you believe in synchronicity, on Twitter, I see a tag for a documentary called Root Cause.
Oh.
Have you seen it?
No, I haven't.
Oh my gosh, you have to see it. It's on YouTube.
Okay.
And basically, it makes the case for biological dentistry and ceramic implants. So I watch it, and I'm grateful that I haven't had the root canal, and I find Virginia Biological Dentistry, which is up in Glen Allen.
Yep.
Happened to get a consult with them because there was a cancellation. And I go in, and they tell me all the things. So glad you didn't have a root canal, because if you had, it could have impacted your heart and kidney, liver, all the things. So it just makes me think about, and they were talking about meridians
Yes.
and how metal implants impact the flow of electricity in the body. Just a completely outside the allopathic model. And who knew? I mean, I never would have thought about it except where I had this weird experience, and then this documentary popped up. And so, I mean, even your teeth, but of course your teeth, because it's all part of the whole system. Anyway, so you gotta watch Root Cause on
I
YouTube.
definitely am.
Very cool.
It's so funny. I had a note in my talk and I didn't get to it, but I was gonna say that.
Yeah.
Where we, when we think about the therapeutic order and levels of intervention, surgery, including a tooth removal, is considered like organ removal. So if it's there, it's supposed to be there. And in Chinese medicine, like you were saying, meridians, they've mapped out each of the connections of each tooth to different parts of the body. So it's like considered organ removal.
Yeah. Anyway.
Thank you all so much.